I would like to invite the speakers. The moderator of the speaker is Dr. Ahmad Mecklai, founder and CEO AAA Healthcare. Mr. Bharat, consultant, Dr. Prem Associates. Ms. Suparna Sengupta, COO, IQCT Medical College and Hospital. And Dr. Mohammad Afzal Siddiqui, founder and CEO, Marlin Medical Assistance Private Limited. Ladies and gentlemen, can we have a huge round of applause, please? Thank you, panel. This stage was set for you. Thank you, sir.
Good afternoon, everyone. So, without wasting too much time, I'll hit straight on the topic. What I understand is given to us is facing challenges to maintain sustainable healthcare and medical tourism in the current scenario globally. I think these are two paradoxical questions. So, on maintaining the standards of healthcare, sustainable healthcare, I think the word sustainable is a very, very vague term. What does one mean by sustainable? Everyone has a different perception of it. So, without wasting time, I will ask the panelists as well to first comment on it. Matt, would you go first?
Hello and good afternoon. I come from a medical college, and as you all know, most of you have been a part of a medical college for a long time. You have done your degrees from there. So, medical college has a very different stake on sustainability because we are generally making doctors. So, here the cost of medical care is not really looked into in that certain terms because here we are creating doctors. So, a lot of free cases, free treatment, free beds, free services are something which we do. But here I am today going to speak about the challenges of medical tourism and sustainability. So I have also worked in some of the corporate hospitals of Calcutta. As you know, in West Bengal the health scenario is a little different. Here our major challenges is the infrastructure. We do have a lot of private players. We have some very good global players also in Calcutta who are entering the market. We have groups like Apollo, we have groups like Fortis also. But mainly West Bengal per se, around 40% of our patients are PBL. So a lot of government intervention is required, and the sustainability factor for the private players is a bit challenging in the recent times. The government has come up with various schemes. One of it is Shishu Shakti, then another is Shasto Shakti. Now in Shasto Shakti scheme, I would applaud the government in some way because it's like all the major procedures, around 140 of them, is covered by the government, and it is rooted through insurance where each family gets a 5 lakh of insurance. Now suppose in the family there are 4 members, so at any point of time, all the 4 members in a particular year can get admitted and can avail the services worth of 5 lakh of rupees of insurance coverage. So it's a very, very smart and good initiative. But what happens is that the private players, some of us, we chose not to entertain them. So what happens is a very big difference, again, between the have and the have-nots. So a lot of people of a very superior quality of life is availing the private healthcare, and rest of the people to avail that quality healthcare has to sell their assets, their land, their houses to get to that kind of care. So it's a very difficult scenario. In West Bengal, I should not say that we are bad, we are medically very, very good. We have created some very finest of doctors who are doing finest practices. We are globally, we are recognized. Just in a recent session by the CII, just 2 weeks back in Calcutta, we met an Australian person, he came from Australia. He was saying that 40% of the Australians are actually treated by majority of Indian doctors. So, Indian doctors, doctors of Calcutta, Bengali doctors, you can see a huge number of Bengali doctors in the US as well. So, medically we are very superior, but the sustainability factor in private, if you are looking at your top line and your occupancy, you do have to cater to the mass population, which is actually BPL. So, this is where I should.
So, ma'am, what would be the most important challenge for sustainability in healthcare to be delivered to the patients? I mean, you mentioned a lot, but what according to you would be the top factor?
I think we need to, mainly the cost of care little.
And with the inflow of Ayushman Bharat, where do you see this going?
See, Ayushman Bharat, we are in West Bengal, since I am representing West Bengal today.
You should actually be on holiday. West Bengal is shut. West Bengal is shut with all the festive seasons, right?
Yes, we are actually on holiday. But anyway, so this Ayushman Bharat, you should know that our Chief Minister has not yet accepted. And if I say that Shastra Shakti scheme, if you really see, I am comparing because one of my very close friend is now, I think he is with Ayushman Bharat, so he was telling me that Suparna, like most of the procedures in Ayushman Bharat, I think by September 30, they are supposed to come up with some new links. They are supposed to have a revision. Dr. Gyani was mentioning. So, but Shastra Shakti rates are much better than Ayushman Bharat.
Question still remains, sustainable healthcare.
Yeah. So, sustainable healthcare. So, not just start with the challenge. So, I'll just start with the very good afternoon, everybody. Basically, you will find in my talking, I'm basically from Delhi, so you will maybe not relate that the challenges in Delhi may be different than the challenges in Mumbai. The main challenges, in the first panel, I'm listening that somebody is talking about the middleman or the dots. So earlier, 3-4 years back, when the Advantage Healthcare or FICCI and NMH started to the conference called Advantage Healthcare. Maybe all of you relate on that. And the CEO roundtable talk was how to eliminate the middleman from the industry. And then we started thinking as an industry or medical tourism stakeholders, how to relate ourselves with in this medical or professional respected industry ourselves. So we find that.
I'm sorry to interrupt. We will talk about medical tourism in round 2. There's a second part which I will come to, but I think right now the focus will be what are your views on towards sustainable healthcare in India. So I will take medical tourism in round 2, but I think let's get this out of the way first and we'll focus on the other part. So your thoughts on sustainable healthcare in the north, since you are from there, I would like you to use that, and for the audience to know as well.
So, in terms of the sustainable healthcare, so basically my background is medical tourism, so I can relate myself in the medical tourism background, medical tourism.
Sure. Okay, so we talk about that separately. So why did you talk about sustainable?
Hello everyone, my name is Bharat. I am working with Dr. Prem and Associate as a medical tourism consultant. And the major challenges in healthcare, more of domestic healthcare market. So here I am going to talk about domestic healthcare. In India, we see that there is more of a curative kind of healthcare. When the patient gets ill, then he thinks about going to the hospital and then he spends a lot of money and he's not ready for that kind of thing. So there should be more awareness. The challenges is in the awareness. There should be more of a preventive kind of healthcare, like a fitness kind of healthcare, where people are taking care of their health and stuff at a very young age, so that they know that following these mechanisms or following this exercise, they can spend less amount of money on the curative kind of healthcare. So mostly the challenges in the awareness. If you go to the small rural areas or the small towns, there people are not aware about the prevention.
They will spend all their life savings where they get ill. They spend all the money they have saved throughout their life, and they will go to the hospital and spend a lot of money. So there is a role of media, there should be a role of digital marketing, the TV, print media, newspaper, where the experts can come and make them aware about the different harmful effects of the unhealthy lifestyle. So there is no lifestyle kind of thing, or like a healthy lifestyle. So very few people are following the healthy lifestyle. So that is where the challenges is there. That at a school level, there should be awareness should be created in the school children about what will happen if you are not going to follow these steps in the future.
Thank you. So I think that you guys have heard the panelists talk. I will also just give my 2 bits on this. As you know, that I run a healthcare consulting firm which has multiple verticals, from building hospitals, operating hospitals is one part. We look at hospital turnarounds, medical tourism is the other, recruitment, skill development is the 4th vertical that we have. And what we've observed in the last 2 years, and there is a paradigm shift in the thought processes of clients, of owners. The word sustainable is hitting everyone. Question is, how do you make a hospital sustainable? People talk about lean design, people talk about lean principles, people talk about how practical it is. And I think what we have discovered, and we've suggested to 3 of our clients, the biggest cost that goes in when a client has a vision to build a hospital, I want this, I want that, I want this. So the focus is more on infrastructure than on the systems and processes. And that's where cost saving. I mean, you can build a hospital at 4,500 rupees a square foot to 10,000 rupees a square foot. When you're talking about sustainability, you look at a 4,500, 5,000 market. You can't have an aspiration. So we try to tame down the aspiration. We say, yes, we make it look good, but your first cost of saving comes in building the hospital. The second cost comes in planning the right human resources. No hospital today is running more than 65-70%. And I'm saying that with a stretch of imagination. People are even running at 30 and 40%. So if your overheads are high, how do you run an organization at 40%? I mean, these are the biggest challenges today that the community is facing. Leave the corporate hospitals, they know how to get the squeeze the time and get the money out. But the regular hospitals, nursing homes, these are huge challenges. And it won't be long before these nursing homes shut down because they can't cope up with it. Ayushman Bharat has not been accepted by most nursing homes. And that is going to come clamping down, no matter what anyone likes it. The government is going to clamp down on that. So the healthcare scenario in this country is a scary look right now. You want to make money, you want to be sustainable, you want to survive. So, and that's what I wanted to stick to that this first round, is that how do we make this, how do we make affordable healthcare accessible to the community at large, keeping sustainability in organizations. And that's a huge, huge challenge. It needs maturity, it needs maturity of the client, it needs maturity of the advisor to advise the client in the right way, and it needs a matured mindset. And I don't think the Indian healthcare industry has risen up or is ready for it. So it's going to take a time. We are going through bad days in healthcare, and let's accept that. It will take time, it will take a year, 2 years for things to settle down. And I'm very hopeful that things will settle down. I am associated with a lot of committees of corporate hospitals, smaller nursing homes, and there is a change that's happening. People are looking at tightening the corners without compromising on the quality of healthcare. So, okay, sorry, that is now serious talk.
See, when we are doing the schemes in the hospital, how do I sustain with Shastra Shakti, if I tell you? Because for a Shastra Shakti operation, suppose you go for a gallbladder surgery, the entire cost given by the government is 13,000. In 13,000, you have to manage your bed, your doctor fees, your nurses, your infrastructure, your medicines, your investigations. Now, for medicines, I would say there is a shift in the mindset of the people. People have started accepting generics. So we are doing a lot of work in the hospital based on generic medicines. So a lot of distributors, even like Sengupta, Zydus, even they are come up with generic medicines. But yesterday we had a meeting, so one of the doctors are saying that, okay fine, if you really want to do that, so I'm out. Now this, see suppose you as a patient, see I am a non-medical, so I go to a doctor, he writes Mecklai, or he writes me augmenting. So you just generally go to a pharmacy and you just, if they give you something else, you just stress on the point as a consumer also, you augmenting tell you. But you are being given, you are not bothered about what salt it is. The pharmacist might try to explain to you, but you are not, you are saying, hey, augmenting likha hai, I want augmenting.
Doctor likha hai, wahi to.
So this, my team member, he was mentioning, ignorance. So consumer behavior has to change. I think more and more public participation, mass teaching, doctors going to the mass, talking, because even the pharmacy in our own hospital I have seen, we have generics because we have to operate at 13,000 gallbladder surgery. Now the efficacy of the drug is also coming up. Now you tell me, if Cipla is making a generic, isn't it acceptable? Cipla is a good brand. I mean, we all know.
So the question is, why did Cipla get into generics?
Yes. Tell me why.
I'm asking you that question.
Because I don't know. Because I personally think Cipla has gone into generics because of the sustainability of the health.
Absolutely.
And to make it affordable and to make it accessible.
So they were more mature than the rest of the pharma market.
Niti Aayog, I think they have also come with this thing. Now, generics is going to take a huge place in our market because people have to know, and consumer, as a patient ourselves, we have to also come up with the terms. See, like Ayurveda, Dr. A was mentioning, he was mentioning that it is an Ayurvedic massage parlor. See, I do a lot of traveling, so when I went to Rishikesh, you can see, those all foreigners, they're flocking to Rishikesh, like we want to learn yoga, spiritual healing, alternative therapies. So a lot of people, I got a study that, AS, ankylosing spondylosis. It has a terrible, otherwise it has been said that there is no treatment of as such of AS. But there are a lot of alternative therapy for AS. So a lot of patients, so now this ignorance, people doesn't know. They feel that, I'll be like this only, I'll be crawling after a few years. I've seen so many rheumatoid arthritis patients getting well by alternative therapies.
So are you saying that there are alternatives to allopathic treatment?
Yes.
Which can lead to a sustainable.
And which can be sustainable.
So this is a sustainable healthcare for the community.
Yes.
What about a sustainable healthcare for an organization? How does the organization get sustainable? One is generics is a shift.
Generics.
But that's not all. Right?
No, not all. Then we have this IRDA regulations also coming up on the implants. I think it's a good move. Your stents and etc. has been taken care of largely. Now we are moving into your hip orthopedic implants. I think surely this regulation is going to come. But you tell me, as a I would ask that what happens to my top line?
That's the question. Everyone
So
said.
we have to have a really yes. So not only medical tourism, I think we have to have a different viewpoint to maintain our top line, because it's not really that, we are not fleecing patients, or we are not, there's not charging exorbitantly, but I think we can make it sustainable. I think solar power, things like that, your, green hospital, thinking of green hospital, this is another way. These are some of the ways which we want to do. The cost of the hospitals, you're saying, the infrastructure, the manpower cost.
Thank you, ma'am. I think we've spent quite some time on this word sustainable, and this can go on for the whole day. But I think I have a task in hand as well. And the second part is medical tourism in the current scenario. We all know that the word medical tourism is a big buzzword in a lot of countries. Everyone wants to be a medical tourism destination. Thailand started it, Singapore was after it, the Middle East is after it, and India is not too far behind. I don't know whether everyone is aware, but the medical tourism market today in India is touching almost $4 to $5 billion. And it is growing at an alarming rate of anywhere between 18 to 20% of CAD. The question is why? Because yes, we have the biggest asset that we have is our doctors. The clinical faculty is very, very strong. And it's not just the health hospitals. When we talk about medical tourism, it includes healthcare and hospitals, wellness, alternative medicines, everything. I would like to request the panel to comment. You can start, since you've been eager to talk for quite some time, and your forte is on medical travel. I'd like to say a few words.
So basically, India has, as I'm talking about the last part where I left, about the FICCI and NABH. So in Delhi NCR market, we have tried to attract the lot of patients from Middle East, CIS, and the African countries. And the main reason was how we can succeed in that. There was one is the flights. So we have a direct connectivity on all these countries. The second, we have organized the all sector. So as an aggregation model or as a medical tourism companies model. So if you are talking about the Mumbai, so as we know that all the small players, like they are running, they are driver or something like that, they are also something points, something relation with the hospitals, offers not in the big hospitals, but the smaller one. So they attract the patients as they know the languages or other things, their relations, or they contact as a driver and they go. So in Delhi NCR market, there was the same things. So what we did that all the hospitals, the big brand like Fortis, Max, Apollo, Maratha, we talked them and tell them there should be a certain parameters. Not everybody come, open the door and come, that we are bringing the patient and give me our facilitation fee. Earlier it was called a cut or commission or something like that. We have started to know. We are giving a facilities, providing the facilitations fee, facilities for the patients who are traveling their country to Delhi. The problem was that the other countries like Thailand, like Turkey, like Malaysia, they have already organized themselves. They have their councils, they have investing a lot of money. But in India, we are little bit late. Government has organized to give the certification for NABH, Quality Council of India, and regulate the medical tourism good players. So what we did, if you are individual or small players, come with a bigger player that they can judge your quality. So one thing we faced in Delhi incident that was the training of the smaller groups or the smaller player of the. So we started to train them as a Al-Shifa healthcare organizer. We have more than 150 medical facilitator or medical individuals. We train them with the master class, with the monthly basis or quarterly basis. Then the one thing we found that there was a missing in false propagation against India. Recently, I have listened one client called me from Bangladesh and told me, oh, I have listened that if any patients coming from outside, they must say Jai Shri Ram. Is it like that? So I was shocked. There is nothing like that. Okay? But there is not a single platform who can handle such type of negative publicity. So we have published 2 magazines started as we have a good number of Arabic speaking countries. So we started a Majallatu Seha wa Siyaha. Then we invested in the Mediterranean today 2 magazines that we can only take in the false propagation against the India. Then we talk hospitals, other states, okay, we bring up one number because as ma'am mentioned, that's a we need a top number. Top number is there, salaries is there, too many things are there. And Ayushman Bharat or other government policy is all these policies give money after 3 months, 6 months, and they need the cash. So in this scenario, medical tourism was giving urgent cash. So we told them, okay, fix some rooms for international and focus on the quality of all the treatments. So starting with their calling to us as query, pre-intimations, visa invitations, pickup controls, each and every levels, we tried on that. So we started the promotional activities as well. The second things, as in the first panel I listened that's NOC. NOC is there, that's any patients who are coming with the other visas or other groups. But what happened, that we are also focusing on, okay, come with the Maratha hospitals, visa invitation, there is a mention that's Maratha the Medicity, they can't travel to the Max hospital. But the problem was that all the doctors are not up, all the department was not supportive for international patients. So we are facing for that. So we we talk to the stakeholders, okay, for the certain level, you can go for that, but not all for that. Okay? Secondly, we have also tried to promote India as a wellness destination. In modern medicine, there is a no treatment for sickle cell palsy. There is a no treatment for autism. But for Ayurvedic, I was also shocked when I learned that there was a 30 to 40% cure are in the Ayurvedic medicines are there with some panchakra and other methods. So awareness is there, but we should also focus on that what we have and we present ourselves. One thing is missing as in this industry, when we talk about India as a medical tourism destination, first we say, oh, come to India because India cost is less. We are cheaper in terms of the US, UK, all first world countries. But we are not focusing on the quality. So we started the reverse. We just focus on you will get the same quality as you are getting in the first world countries. Okay, we have a state-of-art infrastructure, we have a world-renowned doctors, we have all the latest and updated equipments which is available in any other countries we have. So we should also talk about the quality and talk about the alternative medicines as well. So these are some observations what I want to
Thank you very much. Just to enlighten all of you all, I'm not sure if you are aware, but it was AAA that actually set the ball rolling for NABH accreditation of facilitators. And this process started in 2015. When I was overseas and a president of a country told me that you guys have the most unorganized sector in medical value travel. And you guys are cheats. And that hit me very, very hard. Can you imagine a president of a country telling you, as an Indian, that your country is a cheat? And that's when I came back and I started thinking, and made a couple of visits to Delhi, and told the government, this is what our impression is outside. They had no clue how to go about it. Neither the tourism ministry, neither the Ministry for External Affairs, neither the PMO's office. It actually took us 6 to 8 months to prepare a structure to accredit facilitators doing this business. And after we did that, it took another 6 months for them to get through the government agencies. And then obviously, they asked me whether you want to be accredited. I said, why not? And that's how we are India's first NABH accredited company, and then we followed the rest of taken on. But even today, there are not more than 25, 30 accredited companies. And there are more than 2,500 or 25,000 doubts in the country. And that is the challenge that we are facing. The question, the government is working on it. I happen to be involved in a lot of committees, both at the central level and the state level. But it's going to take its time. Till then, the question is, are we compromising our credibility? I think what everyone needs to understand, whether they're facilitators or organizations or hospitals, while everyone wants to make money, it's great, the market is too huge. Let's look at making money ethically, cleanly, transparency, and maintaining the right communications. We call the patient, I'm sure everyone who are in the business will understand, when a query comes in, you give a price of X. And by the time the patient comes to India and goes back, it becomes 1.75x or 2x or 2.5x. I think we all need, who are in the business, to be mature, and I'm repeating the word mature. That for the sake of a few dollars that extra you make, you're losing the credibility at a global level. On one hand, we have our Honorable Prime Minister going left, right, and center overseas to get FDIs to India. On the other hand, we ourselves are downing our credibility at a global level. So I'm putting this question to everyone in this audience to think, to pause, and see how each of us are functioning in this business. And if you truly want India to be the global destination for medical, I don't call it medical tourism, I call it medical value travel, then we all need to put ourselves together and think in one direction. Not looking at putting each other down, because there's enough work in the market. There's enough work in the market. We don't need to rob each other, we don't need to put each other. Everyone has their own territories. Just stay focused on the credibility. Right, Jason?
I would like to add on the some challenges which is not talked about. Some challenges are language barriers, brain drain, and many doctors are going outside India for the different countries. So we would actually need more doctors to cater to the medical tourism, which is increasing every year. We are getting close to 1 million patients from outside India as a medical tourist. And there is also lack of infrastructure and the proper marketing efforts. Like we are catering to only few countries as far as the medical tourism is concerned. We have to expand to the international market. So from the marketing angle, I can say that there are many more African countries where individual hospitals and individual doctors and also startups. We have many startups. So these startups are focusing in new countries like, for example, Uganda, Sudan. If you go to the different statistics of the kind of patients we are getting from these countries, it is negligible. Reason is that the proper marketing efforts has not been made. So till now, if you see the statistics, top 5, there are 5 countries which are accounting for 80% of the medical tourism patients in India. What about the other countries? So we as a medical tourism company has to reach this market by connecting to different doctors, different medical tourism local agents. How we have to train these agents in those countries about the Indian medical tourism market and the new hospitals which are coming up. Also, I think the growth of medical tourism is limited to only top corporate hospitals. There are many individual doctors and there are many tier 1, tier 2 cities which can cater to medical tourism market. If I talk about medical tourism today, there are only 4 or 5 major cities which are doing medical tourism. But I have seen a lot of good hospitals in small cities, tier 1, tier 2 market, which they have started taking interest in medical tourism. They are doing a lot of workshops. We have helped them doing many medical tourism workshops, where we guide them about the standardization in the medical tourism, what you can do as a medical tourism company in an ethical manner. You have to do this business in an ethical manner so that the brand India is created. And definitely, if you are associated with right hospital and doctors, there will be less chance of medical negligence. And if there is more medical negligence, the brand of India will be affected. So these challenges has to be taken care of. Because if there is single medical negligence case in many big corporate hospitals, it is highlighted in many media, international market. And I have seen there are many media agencies they are looking out for such opportunities to find out the fault in the medical negligence. The moment there is medical negligence, they put all these things on their website, and there are some of these websites they have millions of views. When we do any successful case, very few people talk about it. But when we make a mistake, it goes to the entire world. Indian medical tourism market is like that. It affects the medical tourism in the wrong way. So it affects the growth of new medical tourism companies. They start thinking that medical tourism is very risky. There are a lot of legal problems. What happens if a patient comes and dies, and what I will do? So they don't start a medical tourism company, and there is less medical tourism company. Therefore, ultimately there will be less number of engaged companies. And
there will be less because people want to use the shortcut method. They're so used to the shortcut method that nobody wants to go through the process of being NABH certified. Because NABH also lays down the standards. And let me tell you, since we have set it up, the standards are very, very tight. But people don't want. So someone mentioned about Kulava towns and agents. And very true. I stay in Kulava, till today I know. There are hundreds of towns only there. Sorry?
They are just giving us the parameters, but they are not hand-holding us that we can promote our business in the international market or we can.
I don't think NABH is going to promote your business. NABH is here to put the parameter for you.
NABH will take up the quality. But if your marketing effort is not good, your company will suffer because revenue generation is altogether different market, different thing altogether. It depends upon your contact, your networking, the knowledge of the market you are catering to, and the professional efforts you are taking.
Absolutely. So NABH is just a parameter. It's just a framework by which you function. And they are ensuring that if a facilitator is there, he sticks to those minimum frameworks of quality.
We are the first one in Delhi NCR who got NABH and the first one in India. We are the third one in India and the first one in Delhi NCR. No, you are the first one. I know that in India. There is no doubt. AAA is the first one. We are the first one in Delhi NCR and the third one in India. We find that they have a very good parameter.
Sir, you are triple ACG.
No,
ACG.
From
I know you're from Al-Shabaab, but you are triple ACG.
Yes.
It happened in 48 hours difference.
Yeah. So they have a very good parameters. But the missing is that they are not hand-holding or they don't have any specialized or fixed department as they have for the hospitals, as they have for the clinics, laboratories, they are saying that we have a accreditation, this quality or that parameters, and you should fulfill that. But how we can fulfill that, or how we can, so the missing part is the training of ourselves, or changing ourselves. So I'm not talking about the training that you just bring up one guy who is working in the organization, and you bring a relation or partnership in the global market, and you are offering X amount, and he will offer to Y amount to your partner, and your business is shifted to the others. I'm not talking about that training. The quality, how a person or a systems in your organization will be developed. So they have parameters in certain points, but not for the grassroots level, how you can change yourself. That's why people or the medical tourism company, other companies, I'm talking about the Delhi, I'm not aware of Delhi market. They are not eager like Harinder Medicare, like other very pioneer. They have like Safe Medtrip, Pradeep Thakral. They have a more than 15 years old organization, but they didn't apply for that because they are not seeing the quality or the changes how they can bring in their organization. So I think the motivation factor is also missing in any certification courses for the medical tourism companies. Yeah.
This I'm going to talk on the startup point of view. Like the 90 to 95% of medical tourism companies shut down in the 3 or 4 years time. There are some certain parameters you have to follow so that you grow a sustainable business model. First of all, you have to have a good connections from the countries from where you are planning to bring the patient. Okay, and also the soft skills of the employees in your organization is very important. It's not only about the knowledge. It's not only about the knowledge of the employees which is working in your company that is important. 80% of the success of any organization depends on the soft skills. So how you talk to the doctor, how you handle the query with the patient, what is the tag, what is the turnaround time of your company. I have sent many queries to many companies asking about the cost estimate, even to the hospital. It takes a lot of time replying those emails, even sometimes 1 month, sometimes not. Sometimes they never reply. I'm talking about the top hospitals in the intensive patient department. So it all depends upon this. The SOPs in your organization, standard operating procedures, which is there. What is how you are created, how well informed is your employee. So if the employees and the workers working in the medical tourism industry is well versed about this industry, how the industry is growing, and understanding the needs of the different patient. For example, the patient from the Middle East will have different requirements from the patient from Africa. So they should understand what are the requirements of the African patient, what are the requirements of the USA patient, their needs, their plus, minus, what will work for the American patient will not work for the Mali patient or the Bahrain patient. If you properly bifurcate that these are my countries from where I am going to bring the patient, what are the likes and dislikes, what are these changes I can bring into my organization or hospital. So overall healthcare infrastructure will improve. And actually the domestic healthcare and the international healthcare market works in tandem, they work together, right? And someone will argue that, oh, you are not focusing about the Indian medical masses, why you are not thinking about medical tourism, our 80% people are not getting good access. Actually, when you improve the infrastructure of the hospital to cater to the medical tourist, the same patient, the patient will go to the same hospital, right? Same, he will get that kind of ambience, the hospital will hire that kind of doctor, and that will also cater to that kind of patient. So actually the medical tourism will be improving not only to the international market, it will also improve the local domestic market, which is the need of the hour.
Great, thank you. I think I have to stick to a time schedule. Sure, you have a
I am definitely must be doing much better than me because you are into this business. I am talking from the provider point of view. I feel, I traveled in some of the countries where I felt, in medical tourism, they are saying, let us go bring patients, let us go bring patients. The concept has to change. Don't bring patients. I think enhancing your image to the outsiders, that's what touched upon on the last point is what matters. And in Myanmar, when I went, there is a hospital called International Hospital. It's a beautiful, have you seen that hospital? It looks like, I don't know, it looks like maybe 7-star, 9-star hotel. You enter the lobby. The moment you enter, there are 5 big, halls, like a banquet hall like this, and there are chambers. And they are saying, we have invited hospitals from Singapore, Thailand, India to come and do their offices. It's like that. And they're saying, why we want, we want our people to get familiar with your country. So there is a trust factor. Suddenly somebody will just close your eyes and coming to India, it does not happen one day. Our doctors have gone to US and UK, practiced and shown their efficiency. That's why today the Indian doctors are best. So people don't hesitate to come to India because they know medically, clinically, we are super. But what about the rest of the things? Like you are saying, the sensitivity of the needs of the people, the visa, the integrity of the people, the middleman, वहाँ से ये पैसा काट लेना, ले लेना, 30% बढ़ा देना. See, the moment we see a tourist coming, the taxi driver से लेके hospital तक 30% add-on हो जाता है. Why so? It is not needed. It's not needed. So I think the person told me that we want to do skill exchange program. I think that's one more thing. A lot of people want to come to our country to get skilled. I think alternative skills, paramedics, we have to have this skill exchange program. People can come to India to learn something. So the trust factor goes on between two countries, which I think will help. And that's how I think.
Thank you, ma'am. Thank you very much. I've already got a message across that I need to wind up. So I'm going to now leave the floor open for everyone to ask questions. We have exactly 5 minutes for them. Sorry, Dr. Samad, you go up.
My name is Dr. Ahmad. I am a dental surgeon. I want to ask especially Dr. Bharat, all of you, what would be the challenges in the dental field?
Sorry?
What would be the challenges in the dental field to get the patient from abroad? I am very much new in the dental tourism. And what would be the challenges in the dental field?
I think it's a no-brainer that India's dental costs are far cheaper than the rest of the world. It's all about how you position yourself. I mean, I know family members in the US who's come to India only for dental treatment. So it's a no-brainer. I mean, hospital we can talk about, but dental, it's a no-brainer. We are the worst. And it's all about how you position yourself. And that's your own individual vision. Dr. Sam, you want to say something?
Yeah.
Okay, someone just pass the mic.
So, before I ask the question, I would like to give a brief introduction. Myself, Dr. Bharat, I'm a spine surgeon from Ahmad. I have my own nursing home, which is in the process of accreditation. Thank you very much for a good insight on sustainability. I would like to share a view on this. In Gujarat, we have called a Ma card, which is like Mohammad card, and for the sustainability of the community, they have excellent rates in TKR, and you won't believe the number of TKR in last 6 months in Ahmedabad has gone like anything. There were one day, one Friday, there were 400 knee replacements in Ahmedabad, and one hospital has shut down all the ICU beds just to tackle the market patients. Having said that, the government realized and reduced the rate, so the community is sustainable by these kind of activities. But then the question is, what you have asked, what about the organization? If the organization, because in the spine surgery the rates are not that great that we shut down everything and start treating the market patient. And that's exactly how I thought, how can I sustain my organization? And then I linked it with medical tourism. Let's get the patients from abroad and let's help the patients of our country. So that's how the connect is. So now my question to you is, as a single specialty doctor who owns like less than 50-bed hospital, what could be the challenges and what the future for them in medical field?
So I think if that question is to me, I will answer it. I think for a single specialty, it's your clinical outcomes, your publications, and your research. And then, of course, you have to use your marketing skills to reach out to the right audiences. But most importantly, I think the clinical outcomes of what you do are going to come as a strong positive for people to fly down to Ahmedabad to use your services in the hospital. And let me tell you, the world is becoming smarter. People are looking at clinical outcomes. Gone are those days where तुमने बोला ये डॉक्टर अच्छा है, go to this one. It's gone. Those days are far in future. It's all going to boil down to what clinical outcomes you or your organization do, what are your publications, and that's how the global community will get a benefit. I hope that answers it.
Thank you.
I'd love to add that. Many other countries, from patients are traveling to India, you can also start a fellowship program. So the doctors who are in their own country, and you can just hand-holding them, and skill change, okay? And recently we are also seeing that the good doctors are traveling to the destinations for a short period of time. They are doing procedure over there, train the nursing skill or supporting staffs over there, and it's basically it's a knowledge exchange and of course the regulation.
See, we had a doctor who was like starting his own infertility practice. So what he did for his pickups and all this, there's a procedure. He trained some Bangladeshi doctors. He went to Bangladesh. He trained the doctors for ovum pickups. So they used to do the first-hand job, and then he used to go and do the final thing. So the moment you have this skill exchange between two countries, they become more warm to you and they proactively help you. So you can do something like that.
And just a question, the skill exchange was just a backup for the legal permissions given in Bangladesh. So, so Bangladesh is pretty strict about it. And so, anyway, so any further questions? Because before I wrap on my knuckles for overshooting the time. No more questions? All right, thank you very much. Thank you, panelists. Thank you.
Thank you very much, panelists. Thank you very much. I hope you enjoyed the session. Just